Well, good afternoon, everyone, and welcome to the Idea Sharing webinar on Spanish language options. And welcome also to the Colorado Healthcare Foundation members on the call with us, Dara, Hesse, and Rose as well. And most of you know me, but for any new folks, I'm Dr. Jim Myers, and I'm a patient portal healthcare consultant for the Foundation on this grant. I will be your facilitator for today's webinar. Before we get started, I'd like to go over a few housekeeping items. Our webinar today is being recorded so that others who could not attend can watch the presentation later. As always, we'll post the recording on the Dropbox site and via an email that will go out to everyone in the next week or so. In order to minimize background noise, your phones have been muted in a listen-only mode during this presentation. However, feel free to ask questions at any point during the presentation by using the chat dialog area located on the lower left-hand side of your screen. That portion of our webinar, the final portion of our webinar, will be devoted specifically to questions and answers. And also encouraging you, if something really does come up that you want to stop our speaker for just a second and ask a clarifying question, feel free to unmute yourself using *7. And for our presenters today, just as a reminder, as I just said, if you press *7, you do unmute your phone, and *6 remutes you. And Brad, you're one of our presenters who will be taking over the screen and sharing with us, so I'll help you through that when your time comes. For all participants, if you have any technical difficulties during the webinar, please call ReadyTalk's toll-free technical support number at 1-800-843-9166. And make sure to have your registration confirmation available when you do call that number. And finally, after the webinar has concluded, you will have the opportunity to give us feedback through a short survey that automatically pops up on your screen. We ask that you take a minute and complete that survey, which helps us to improve our future presentations. And now on with the show. Let's see, I'll switch to the next slide here. And welcome, everybody. And I'm not so good at Spanish, but bienvenido. And there's a nice shot of a rug that I got off the internet in a children's clinic. And it really, I think, highlights what this is about. This is a webinar that recognizes our vendors are not having a Spanish options to their portals yet, with limited exception, which we'll hear about one of those today. And we're doing lots of things to work around that and trying to still reach out to our most vulnerable patients, and especially to those who don't speak the English language as a primary language. So today on the agenda, I'll give you a short overview about things we do know across our work, Tom and I's work, and some of the readings we've done. We'll show you the resources on the Dropbox site, and then we'll launch right into our idea sharing. But first, as always, we have a survey for you. Do you have a Spanish language patient portal? Our first choice is our vendor offers it. We use it. The second choice is our vendor offers it, but we're only in the testing phase of it. Our vendor offers it. We don't use it. Our vendor promises it within 1 year, or our vendor promises it but without a time given. And go ahead and start filling in your survey. And it looks like you should each have an option to look at the results. And it looks like one of our respondents thus far, or two of our respondents thus far, their vendor offers it and they use it. 2 responders are saying their vendor offers it and they're in the middle of testing. And 4 are saying the vendor promises it with no timeline given. Okay. And let's go ahead and move on to the next one. And so here's the basic overview of what we know so far. I think across the country, most vendors are still delaying their Spanish patient portal option with limited exceptions. We are finding that most of the clients we work with are doing various things to try different workarounds to the fact that their portal isn't offered in the complete Spanish version. And we also know that the first vendors that are launching out there have options that are pretty clunky. We'll hear a little bit more about that today from one of our presenters. But I would say in general, most vendors are putting it together, are right on the cusp of releasing, and it's going to be a pretty big marketing thing to have it going and have it available. So I think once the first good ones are out there, I think we will likely see everyone else follow quickly right there behind. and offer a good Spanish portal option. We have seen quite a few folks try the Google Translate specifically, or something like Google Translate, and each have had mixed results. We know that in today's practice of care, emergency rooms use Google Translate and find that it works good enough to kind of answer very, very basic questions. How did you get that bump on your head kind of questions. And when you try to then translate that to written language, it doesn't always translate particularly well. I think the greatest success that we're seeing with Google Translate is the translation of just the headers, or if you will, the folder names that are seen often at the top of a screen. And unfortunately, that then invites those who don't speak English to continue to drill down into the portal and then have mixed feelings about having only English choices from that point on. What we do find is that it is helpful for our Spanish-only speakers who are working with a family translator, like it often is someone who's younger, who's in school, an elementary school or a high school. They've learned, they've come to the United States if they're migrant workers, for example. And so that kind of mixture of having some things in Spanish, which makes the older person who doesn't speak English feel more comfortable that they're kind of migrating to the right page, and then having someone there with them that will help them translate the rest. So there is some success. There's a need to get ready for equity and equality in communications. All of us are experiencing that now, I think, across the country, where there's a real effort underway in our safety net to offer the same kind of communication options to those who don't speak English if their predominant populations that they serve are non-English speaking, and seeing that this is an equity issue. And so there's a lot of folks who really are very, very interested in these workarounds and very interested in continuing to communicate to their vendors that they want the Spanish portal option, that it is a fairness issue or an equality issue. And we often see that as a primary reason people are sort of scrambling to try to get things going. It's also time to get ready for that, in a sense, thinking through how, when you turn it on, you're going to translate when the messages come through in ways that are translated just as nicely or equitably done and stored in the record as you would with an English-speaking person who's written an English-only message that's come through. So it's around equality or equity, and we're seeing that as a sort of byline or tagline to this effort as well. And then ultimately, we're seeing different types of translation services looking into how they can support a lot of folks that already have a lot of their clients are speaking multiple different languages, have the sort of different colored phone in the exam rooms, and they can lift that up and use it, are also kind of working with that as well and sort of reading what they see on the screen with the portal. There are lots of different translation services that are beginning to think about ways they can support those who use the portal. And then we have some folks, we'll hear some today on this as well, and that is how to take your bilingual employees that you have right now, send them through some level of certification so they can translate in a good way what's coming through the patient portal as well. So I think that's generally what we're seeing on both now and on the horizon. And in the Dropbox services we have for you, we have quite a few resources that are Spanish speaking or Spanish written, marketing materials, trifolds, posters. And again, a lot of these are from you all that have shared them, but also we have had foundation funding from across the country that has provided us money to produce them, making them available to everybody for free, and just encouraging you to look at those again if you haven't looked at them for a while. There are some new ones in there, and grab those free poster materials and trifold materials and put your name on them and use them as you wish. And then we also have in the resources Dropbox patient portal user guides as examples in Spanish, Spanish portal sign-up sheets, online surveys, instructions on how to, or videos in Spanish on how to use the portal. So it's sort of like a video frequently asked questions process, and there's a link in there to some examples, texting examples, and then ultimately there was a case study that we did that is a interpreter certificate program, and it's called X-Culture, to give you an example of what a certification program looks like. So we have that in the Dropbox as well. And now we have our second survey. Have you tried a Spanish language workaround on the portal? And you can choose in there clients can choose a Spanish option. So if you check that box, that means there's a drop-down box menu that it can choose an option for Spanish. The other choice is we built in the Spanish options ourselves. The vendor built it in as a Spanish option, or there are no Spanish options at all on our portal. And let's look at the results. So have you tried a Spanish language workaround on the portal? And can the clients choose a Spanish option on the portal landing page? And 4 of you said yes, you do have a drop-down menu where they can choose Spanish, and 4 have indicated there are no Spanish options at all. Thanks everyone for participating in that survey. And we have one more that's come in for there are no Spanish options at all. All right. And moving on to our idea sharing, let me just start by thanking all 4 of you for agreeing to share with us your Spanish workarounds or what's going on your portal that's linked specifically or addressed specifically the Spanish portal option. And that's the Metro Community Provider Network and John will be going first. Summit Community Care Clinic, Colleen and Becky, Rocky Mountain Youth Clinics, Brad, who will also do some screen sharing with us, and Bruner, St. Joseph's Hospital, Chris. Thanks again, everyone. And let's get started. John, you're up first, and that would be *7 to unmute.
Hello, everyone. Can you hear me, Jim?
Yep, sure can.
Okay. I'm John Denny. I'm the Clinical Project Manager here at MCPN, and I guess my title says Clinical Project Manager, but primarily my last year and a half has been working towards not only developing and relaunching our portal, but also coming up with ideas that can expand our horizons with the portal. So it's my title's kind of broad, but my duties have been pretty narrow lately. We use General Electric Centricity, and they have no Spanish version, which was kind of bothersome to me since, as you can see, 34.7% of our patient population prefers to communicate in Spanish. So that really points to a heavy need for Spanish, and that's something that kind of required us. And we basically use the Google Translate that I'll discuss here shortly. As far as measuring the way clients connect to the patient portal, we really don't have a way. I can see patients who and run reports on the mobile devices when they log into the mobile devices and what forms they use, but really no other way to see if they're Spanish or any other things. So that's really a kind of a sticking point as far as trying to come up with calculations and so forth on how patients are actually using the portal and how they're connecting. So what we do is we use a lot of forms in Centricity. The portal in Centricity uses forms. And the forms basically, a patient can fill them out in Spanish, and the first line of communications that they go to is our customer care center. And the way that is done is we use a routing process in the portal. So for each particular form, we'll basically, in most cases, there's obviously some that are a little different, but we'll route them to the customer care center, and they'll respond and answer back to the patient, at which time the patient, and as I said, we use Google Translate, the patient can take that English language and turn it into Spanish and at least get an idea of what kind of response they got from the customer care center and or their provider. Translation services. Translation, we use the Seracom translation services, and what that means is there's a blue phone in each one of the exam rooms, and essentially all the provider or staff does is pick the phone up, and there's somebody there right away, and they determine what language is being used and start using it. Also in Centricity, we have ways to, we have a setup so that if there's Spanish or any other language, that is set up in registration. So we know coming into the day what patients we have that are going to need translation services. And as you can see, Spanish is overwhelmingly our number one usage. But with a lot of the refugee patients that we have coming in and so forth, we're seeing more and more other languages other than Spanish pop up. And I think it was in June, we had 43 different languages used in June alone as part of that 27,000 minutes. So as you can see, there's a lot of variety and a lot of communication services that are really needed beyond Spanish as well. So as I said, we use Google Translate, and I'll show you how it really worked best when I really set it up. When I first started setting up, I'll give you a little history. When I first started setting it up, I thought I had to do it on every page and set up the translation service on or the translator on every page. But what I found out is if I put it in the main page, in the header of the main page, it will follow through. So not only will each individual tab have a name change, have the Spanish name on it, but the contents will be in Spanish as well. So that really helped as far as make sure that the content was consistent all the way through. And then with each page, you can either inherit or not inherit that main page header. So if I have a page where I don't want to use it, then all I have to do is click it, check mark. And the way I set Google Translate up was to accommodate our top 10 CIRICOM languages, so that's only seemed kind of natural. You can use, it's like up to 60 languages in Google Translate. In addition to that, we have video players in 14 of our exam rooms that will play English and Spanish, not only patient portal, but healthy living tips and things like that to accommodate for our language barriers. And then what really has really played big, and we really started it up with our patient portal, was bilingual staff in particularly the larger facilities. It does go beyond the larger facilities, but assisting with portal registration and just overall patient assistance. And we have a team called our courtesy and safety team, and they are very visible in the waiting rooms, and they will not only assist patients in portal registration, but they'll actually show them what to do if they have questions. So that has been very beneficial for us in really moving the portal along. Next. So what you do with Google Translate, and I don't know if any of you ever have set up Google Translate, but essentially you have to have an account with a Google account. And what you do is you just go into the account and you determine what languages you want to use. Like I started out with all of them. And found out that is it's pretty confusing when you open it up and there's 60 languages. So that's when I started just really refining it down. But what it does is at one point it'll give you a source code, and what you see on the page here is the source code. And basically, once you get that source code, you just lay it into the portal itself, into the headers. Next. So this is a screenshot, and as you can see, and each system might be a little bit different. Centricity has a source and a designer tab, as you can see, marked by the arrow. So in the source tab, all I do is just paste in that source code. And next. And what it will do, it will populate the designer with that select language. And next. And also, and what I had mentioned earlier is there's an inherit from the parent. So essentially your main page is the parent, and then any other page like the inbox or any forms, documents, things like that. If you inherit from the parent, then that select language page will show up on every page. If you uncheck that, then then it goes away for that particular page, and that was what really was a good feature, particularly when it came to medical records, which there were some questions about. Next. And this is how it just basically lays out. This is a screenshot of our test patient portal, and so it just lays out right there, and you can kind of place it wherever you want. I just always place it in the top left, but and from there, when you select a language, it will automatically pop over to that language, and there's a bar up above that it says Show Original, and it'll take you back to English right away. So it's very intuitive. Big lessons learned so far. You always learn by doing, and I'm terrible about that. The bad is if you go in to edit a page or add content to any page, the main page or whatever, what Google Translate will do is it will multiply. So if you had one language selection bar and then you save that changes, you'd have two. I think I had one day where I had like 6 or 7 of them up there. So I found it is really important that when you get that code to save it to Word, and that way copy and paste it from Word into the source. So now whenever I go in and want to work on a page, I'll just go in and I'll just wipe that source code out and save the main page and then work through it and then add it back in. So that can save you some time. And then, as I said earlier, there's some questions revolving around accuracy, particularly when it comes to PHI, and that's where that inherit page comes from. And hopefully a lot of the portals are set up similar so you can inherit headers and things like that. So that was a good thing. Also, the good, it's free. Yes, that's always good, particularly when we priced out some different Spanish language options, and they were very expensive. So we found that this was a good solution that sufficed as far as, it may not be the most accurate solution in the world, but I think it gets across what patients are looking for. And also, as I had alluded to earlier, there are just multiple languages, and it's easy to set up. Once you get the feel for it, it's really simple. And you can go back in at any time and add or subtract languages or just do whatever there. And that's about it.
Well, I wish there was some way in the ReadyTalk that we could do a big round of applause and show you, all of us, thanking you so much. As a member of the previous cohort, you're coming back still to do presentations, and I can't thank you enough. Of course, everyone's invited as they conclude Cohort 1 to attend these, but man, it's really stepping up, I think, to continue to present for us. You've got some great ideas here. Thanks for putting the time into it very much.
Sure, and and essentially, Jim, just what I got from the whole cohort during the time that we had it was very valuable, so I don't have a problem doing that at all, so I thank you very much.
Wonderful. Thanks again. All right, next up. Star 7 would be Colleen and Becky from Summit.
Hello, this is Colleen Clark. Can you hear me?
I can, Colleen. Thank you.
All right, thanks. Okay, so we're from the Summit Community Care Clinic. It's a lot of our patients are underinsured or not insured at all, and a great number of our patients are Spanish speaking. And we actually have 2 language descriptions, and that is their preferred language is Spanish, and their preferred language is Spanish, and that they need an interpreter. So we really do track these patients, and when we have a lot of data on them, and so we can best serve them. So our portal vendor is Aprima, and it's in beta version right now. So I'm talking to you in a state of transition. So when I say like old portal or current portal and then the new portal is the Spanish version where there's a separate login. There are 47% of our total patient population is Spanish speaking. And then as far as our, we don't have the system generated reports either. They're supposed to come out in the next version of Aprima, but we've done some custom reports and we found out that only 27% of our total patients on the patient portal are the Spanish speaking. So there is definitely a discrepancy as far as our total patient population and those who are Spanish speaking on the patient portal. Okay, we do a number of things as far as incoming and outgoing messages that are both in Spanish and English. What we do is we'll reply to a message in Spanish. And for those who are not bilingual, the providers who are not bilingual, then they will use the tools Traduca, I don't even know if I'm pronouncing that right, or Google Translate in order to reply. And then anyone who is Spanish speaking will have a very long visit summary or clinical summary as Meaningful Use calls it. And because we will have both the English translation for, the English version for the chart, and then we'll have the Spanish translation also stored in the chart and then printed out for the patient in the form of patient education or, like I said, that visit summary. And but what I think has been really great is that we have bilingual front desk who intake the patients, and then we have the clinic assistants who check the patients in. And then we have health educators who are also bilingual and that work with the providers. And so there's always somebody bilingual in Spanish with the patient at all times. Next, please. Okay, so again, using the bilingual, there are some clinicians who are bilingual. And then, of course, there's the staff that I just mentioned who are bilingual as well. And then they are instrumental, especially the bilingual health educators, in providing one-on-one teaching and classroom-based training in Spanish and English. We email communications in Spanish and English. Again, those custom reports that we built so that we can determine, okay, who's on the portal and what language do they speak, has been instrumental in how we promote the portal. And then we have posters and postcards in Spanish and English promoting the portal, and they're all over the clinic. And then there are bilingual portal team members that advise us on how to make the new portal better. And they're the ones who tell me, oh, wow, Google Translate is really not where it goes. But anyway, but coming soon, we're going to launch the new Spanish portal. And I'm hoping that is going to be in the next week or so. And because it's at least, the new portal is at least as functional as the old portal or the current portal. But it's not only has the Spanish login, but it's better as far as navigational design. And then there's been some fixes in place so that the functionality that we promise our patients is actually there. It's present now. Next, please.
Sure. I just want to step in and say I really love during the calls that you said, we're looking at the beta version. We're not going to release it out until the Spanish portal is just as functional as the English portal is. And I like that approach. Wanted to mention that. That's
correct. I'm dependent upon specifically there's Jennifer Gonzalez. She's kind of in charge of a lot of things, and things that nobody else wants to do, she'll take charge of, and she provides feedback right away on anything that I give her that is Spanish, any Spanish communication. I give her something in English, and then she provides the Spanish equivalent. And I know enough Spanish where I can listen, and I know that there's more maybe more slang when this person speaks, and then there's like an upper level Spanish that is more consistent across different cultures. Just because they can speak Spanish, it doesn't mean that it's appealing to a bunch of different cultures, like Central and South America, that sort of thing. And so I really rely on one particular person specifically to give me that, better, more general representation so that we're not offending people, just because of my ignorance. Shouldn't be the threshold. So I just wanted to show you just a quick screenshot. I'm not going to go into it, but there is, when you log in, the default for me anyway is what comes up for the language is English. But if you already have your web browser set to Spanish, then you will see that the Spanish will come up right away. That will be the default. And so when Jennifer Gonzalez, goes to this website, she sees the Spanish version right away. But there are instructions as to, okay, how do I get to the Spanish if Spanish is not the primary language set in the web browser. Okay, so I'm going to get right to it. I reversed the order a little bit of the good and then the bad, and then I added the ugly. So the good is having bilingual staff, especially those who are rather worldly and they can represent many cultures, or at least are sensitive to many cultures who speak Spanish. And I think it has benefited us to join the beta program. And it was risk-free in that we did not have to expose our patients right away to the new portal. They gave us a separate URL or website address in order for us to test the program and its functionality first. And so all we will have to do to launch it is change the website address on our website to the new portal. Instead of launching something or sending out the new address or whatever, we just have to make one simple change. It will take me about a minute. As far as the bad, there's a lack of functionality in the patient portal. And the biggest functionality that is lacking is mass promotion. We do not have a means of mass promoting. And what I mean by that is I've worked with 4 portals before this one. And in the past few years, there was systematic global functionality so that, okay, a patient comes in and the front desk person changes their email address or makes some change on the demographic screen, and then there's an email address that's valid. So automatically that patient, if that patient isn't already on the portal or doesn't already have an invitation, will be sent automatically an invitation to the portal. And there's a primary or temporary password that the patient can use and that we could reference in the invite, saying that, okay, that's the last 4 digits of your Social Security number or the year of your birth. Aprima does not have that functionality. If we need to set somebody up on the portal, we are assigned, individually assigned for that patient alone, a randomly generated password. That's the only thing that we can use. According to Aprima, the year of the birth, even though it's like it would be a temporary PIN in order to activate the patient portal account, they say it's a security risk. And so that's just the way that it is. We can't mass promote. And so we were hoping that Aprima had promised that there would be patient self-registration, and then there would be a check so that I would get an email, for instance, saying that, okay, this patient wants to join the patient portal. Can you make sure that this information matches the chart they already have in our EMR? And of course, I've worked with this functionality before, but this functionality is not ready, and I don't know of a date when it will be ready. They promised it in this new version, but it's just not existing yet. So, and there's a long time to wait for what I consider to be basic functionality. But then again, I've been exposed to patient portals that have higher levels of functionality and years ago. So when it comes to the ugly, it seems to be that with our EHR vendor, it's just kind of a culture shock. I mean, they don't have the functionality. I mean, and this thing seems to be new for them, having a Spanish portal. Again, I've worked with a portal for the past few years prior to coming here that already had the Spanish portal years ago. And then, so I just feel like sometimes when working with Aprima that this was kind of secondary. So where it wasn't really that important. I mean, I think if it were more important to them, they would have had some basic functionality with Spanish a long time ago. And when working in the beta program, there's been things which on one hand is really great. Okay, so I've talked to them about, we need to have an automatic severing of proxy accounts. That means like the parent will have access to their child's like immunizations, their chart, that sort of thing. But when the child comes of age, or when we decide, okay, we need to have this chart severed from the parent's view or from the parent's access, then there's no automatic severing of those two accounts. And so we just do not invite minors to the patient portal because we cannot control that access, and there's no automation of stopping that access. So we just don't even, so we exclude anyone who's a minor, which is unfortunate. And
Colleen, we're going to move to the next person soon. You have about 30 seconds. Thank you.
And then, so that was the problem that we've had is like, okay, it's the portal is behind the times, and trying to convince, our partner what's really important so that we can both move forward with a functioning portal.
Thank you very much. And it's awesome to have your perspective as someone who's seen an actual version of the Spanish portal. So thanks very much. And next up is Brad, and that's *7 for you, Brad.
Hi there. Can everybody hear me?
Yes, indeed. So we're going to have to, let's see, about 6 to 8 minutes to stay because we have one person after you. Thanks very much.
Sure. We'll be quick about it. So hi, everybody. Good afternoon. My name is Brad Barfield. I'm a project manager at Rocky Mountain Youth Clinics. We're a pediatric safety net clinic operating mostly in the Denver metro area. And we can go ahead to the next slide. So our portal vendor is MedFusion. So our EMR is GE Centricity, but we decided to go with an EHR agnostic portal vendor, actually primarily because we knew that there was a Spanish option coming soon after our launch. We launched our actual portal in October and had a Spanish version, which you'll see soon, set up by January of 2016. You'll also see that the functionality of our portal is not insanely comprehensive, but again, it was really important to us that we had a Spanish version set up, which is why we went with this sort of this vendor outside of the EMR. We have roughly 35% of our clients who have explained to us that they want to communicate with us primarily in Spanish, although we know that number is actually quite a bit higher for us. That number is like literally what exists inside our EMR as the patient's defined preferred language, although on a day-to-day basis we're speaking in Spanish to many more patients than that. And this next piece is mostly anecdotal. We have a bilingual patient portal engagement specialist who speaks with patients in clinic, bounces back and forth between our main clinics, and anecdotally knows that there is some smartphone usage. Our portal is mobile responsive, but the vast majority are still using the portal on either their home computer or work computer or computers that we have in kiosks in the clinic. So in terms of our background, we have the vast majority of our staff that interacts with patients are bilingual, and so in terms of messages that are coming in through the portal, our nursing staff, who is entirely bilingual, focuses on sending those responses back. And technical questions that have come in through the portal, which go to me, who does not speak Spanish, those have been very minimal. I've been able to use our bilingual staff to help out with those as well. In regards to using translation services, generally speaking, this is not really about the portal, but for, as I think John mentioned, we do have refugee and other populations that speak many other languages besides Spanish, so we do have translation services available, although our workflows have sort of been wrapped around having bilingual staff connected to the portal at all times. Next slide, please. And so in regards to our workarounds, so we have an English-Spanish toggle that presents across every single portal page, and that's what I'll show you in a minute. That's our main big portal feature, in addition to our bilingual staff who are able to talk about our portal, the functionalities involved in it, and help folks get set up. Again, what I'll show you in a minute is that we have our directions, our instructions, and our labels of the portal translated into Spanish, which when we launched the Spanish portal, our portal vendor kind of did all that in one fell swoop. But as we add new custom text to the portal in English, we have to have a translation service translate that text, and we have to manually import that into the portal, which again, where I'll show you in a minute, has led to some inconsistencies in how that experience looks. We also have, again, for the patients who have Spanish listed as their primary language in the portal, invites automatically going out in Spanish as opposed to English. And we also have the ability to translate our forms into Spanish, although we've had some challenges with that as well, which I'll show you in just a minute. Next slide, please. All right, so now I'm just going to share my screen for a little bit. So Jim, I just clicked this share button up here.
Yep.
All right. Okay, so hopefully you can see what our portal looks like. So it's relatively basic. This is the English version of it, and if I toggle up here, there's a Spanish toggle. This toggle actually used to exist in this dark blue banner up here, and maybe a couple of weeks ago they stuck it into this drop down, which I'm not super happy about. But anyway, if someone clicks onto this experience here, it translates all of our labels and such into Spanish. So now messages here, ask a question here, bill pay here, and then again on the left nav here. Again, where you can see that we have some challenges is that there are certain levels, parts of the portal, including this banner right here, where we have to kind of like stick the English and Spanish stuff together because that's just the way that the site is built, where these sort of sections are kind of global. So our main banner, we have English and Spanish here. If we go to our forms that folks can fill out, and that is not letting me go into that. I apologize. Here we are. This form section here has to have both English and Spanish forms in there at the moment because those sections are not separated out between the English and Spanish experience. And so that's basically what I just kind of wanted to show you guys around what that looked like. Again, probably like I would say 85% of the experience from a Spanish-speaking patient's perspective is relatively good, but there are still some things we want to try to improve. But that's going to be completely dependent on the vendor themselves. So I'm going to Jim, how do you take that back? screen
So
share.
at the very top it says full screen stop sharing. Do you see that up there? Maybe I'm not seeing it the same way you are. There we go. You got it.
There we go. Perfect. So lessons learned thus far, again, the consistency is not great. It's not at least 100%, and we were sort of promised an immersive Spanish-speaking experience, and there are some English remnants still left in there, which is not great, but seems to be getting better. And generally speaking, like technology is hard to translate into any other language other than Spanish. So great, got a Spanish portal, this is awesome, but there's no indication that this sort of immersive experience will be available in any other language other than Spanish anytime soon. But at least for us, the good is that this option was mostly automated, so that's great, and that all the translation services behind Medfusion and what they were doing for us in the back end was were by certified translators, so we felt relatively confident in the quality of the translations that we would be getting, and that for moving forward, when we would have to do some of the translation ourselves, there are some cheap certified translation services that that help us out with that and can mostly turn those around relatively quickly and cheaply. And I would say this is sort of a good and bad thing, but it does seem like the vendors are moving quickly in this direction. But there's a lot of really what they might seem to be very small details that actually provide some pretty big challenges for actual Spanish-speaking patients and users to the system that seem like small things that are actually really big and jarring when you're hoping for an experience that's more immersive. Yeah, that's our experience. I'm happy to answer any questions towards the end of the session.
That was amazing. You just went through a ton of information in a short time. Thanks so much, Brad.
Sure thing.
Next up, Chris from Brunner.
Can you guys hear me?
We can.
Excellent. All right, guys, my name is Chris Ward.
You're going to need to speak a little bit louder.
Great. I'm bringing this a little closer to me. Is that better?
Much better, thanks.
Great. So I am an ambulatory informatics specialist here at Brunner Family Medicine at St. Joseph Hospital. So our portal vendor is Epic, same as our EMR. We use MyChart. They obviously do offer multiple languages, but it is up to the individual organizations using it to build their own. So we are waiting on our 7-region system to build it out, and they've given us a possible date of end of 2017 for us to have that. We are waiting anxiously. So about 40% of our total population is Spanish speaking. Of our active MyChart users, that is about 26%. And I say preferred language, lots of those do have obviously some English skills as well. So as far as mobile versus web-based logins, we can look at a system as a whole. This is one of the reports. I'm not able to break out by just our patients at our department alone or by language yet. Working on that one. But if we look at in May of this year, 9.2% of all users used a mobile device. And this is kind of interesting. I see 12.6% of all logins were on a mobile device, which kind of goes and shows you that mobile users are logging in more often as well, which is kind of neat. So hopefully we'll have a lot more time to work on some of that data. I focus just on one workflow, the one we've currently been trying to tackle rather than addressing lots of the other ones. We were trying to figure out how do we utilize our English portal for those patients that are Spanish speaking that sign up, and how can we respond to them when they send us a MyChart message. So here's a workflow that we had hoped to use using current tools and staff at the clinic. If we received a MyChart message, it would go to the MAs first. We're able to elect if it goes directly to the providers or to the MAs. They're going to create an account, and then they would respond to the patient saying that we can only respond in English right now. However, they would receive a response in 1 to 2 business days. We then had 4 interpreters, MAs certified in interpreting, and we were thinking to be able to use them to translate those messages, send them to the providers. The providers could then, if needed, so we have some protocols. If there are certain telephone calls or email messages that an MA can answer. So first it would be dependent upon if they can answer or not. If not, it would be routed to the provider to respond in English. So that was what we were hoping to be able to do, but as we dived a little bit more into our hospital policies and spoke to the language assistance director here at St. Joseph Hospital, and if we hop to the next slide here, we found the difference between interpreting and translation. So we have actually 4 MAs that went and did a Bridging the Gap interpreter certification program. We went through Mile High Multilingual Services. It was just a 40-hour training program. It's about $750 class. Basic interpreting skills, the ethics of interpreting, protocol, learning the differences between the simultaneous and consecutive interpretation. After we sent them to that, which is great, we can assist in the telephone calls. They can assist in room face-to-face if needed. We prefer to use our translation services if possible. This is kind of a last resort for those. But on the next page, what we found out on our next slide is the difference here. Interpretation was defined in our policy as a conversion of a message spoken in a source language into an equivalent message in the target language. But that was just spoken language, orally. So if it came down to anything written, a translation certification was going to be required instead. So the translation certification obviously being more in-depth, being language-specific, and I'm sure we're looking into right now the cost benefit of sending our internal staff to be able to perform this duty for us. So being a big organization, all these little laws and things we have to follow, it made it a little more difficult for us to be able to perform this. So the good, the bad, which I didn't fill a slide out for, but oh yeah, so here's a workaround that we have currently. Forgot about this slide. We just have a little Spanish blurb put up, so if once they sign up and log into their MyChart, we do explain here saying that we do not have a Spanish version available for them, cannot respond to messages, results, schedule appointments, or anything in other languages, but to check back periodically because we are working on it. So between that, we are still receiving messages, and we are still now trying to figure out what workflow we are going to do to work on those, to respond to those. The good, we have tons and tons of interest from our Spanish-speaking patients to use this, and we have a lot of Spanish speakers that are signing up every day. So that's really great, putting that power in our hands. But the bad is waiting on a large system to be able to make that decision for what might be a smaller population for the system as a whole, rather than for our clinic specifically to be able to get that website built and maybe implement the Spanish app as well. So yeah, there we go.
Thanks so much.
Thank you.
It's interesting. As we entered this idea sharing, we thought, well, we're going to show examples of patient portal options, but it's often it has also opened up a lot of other questions, like what is the difference between interpretation versus translation? And we so appreciate your comments. I think it certainly has given us more things to think about as we all prepare for this to be a common function. Shannon has asked the question on the chat box. We have found that most of our staff has stronger spoken Spanish than written, and don't feel comfortable asking staff to communicate in written Spanish due to the potential risk. For those practices who have bilingual staff translate the messages into Spanish, do they test employees to see if their written Spanish is sufficient? So, right. Chris, why don't you answer that, and any of our other presenters who want to weigh in, please star 7.
Yeah, for us as well, all of our staff are bilingual. Well, the majority of our staff are bilingual. But they determined that we are not allowed to use them unless they do have a certificate completed. So even just for verbal interpretation, there's only the 4 MAs who are legally allowed to do that within the clinic, and translation, that's what we'll be working on next. So.
Mm-hmm. Anyone else have experience with that, wish to share? We've got about 1 minute left. Does anyone use their bilingual? Go ahead.
Oh, sorry, this is Brad. So
Brad.
we do not test our employees. I think one of the ways that we've gotten around that a little bit is by really trying to tailor the sorts of questions that we answer through the portal and making sure that they're not of a specific clinical nature. Also, if they're of a specific clinical nature, we have the providers call them back anyway, and so that or the RNs call them back anyway. So we have that, again, that sort of that verbal communication as opposed to something that is a little more rife for liability. But yeah, I mean that I feel like that's been a challenge for us as well.
Mm-hmm. Yeah. Work with a lot of people who are bilingual, but they're not necessarily bilingual to the point where you can trust the written translation, that's for sure. And we've had other folks comment on this call, this webinar, about the different types of Spanish. There's not just one type of Spanish. There's a very cultural perspective from Central America or South America as well. Well, thank you, everyone, for participating in those who participated today. If you have any further questions, we have run out of time for questions. Send them to me, and I'll shoot them out to folks to get answers for you. I want to thank those who helped us today to make this happen. John at Metro Community Provider Network, Colleen at Summit, Brad at Rocky Mountain Youth Clinics, and Chris, thanks again, out of Bruner. And certainly Rose, who's in the background at TCHF, always helping us, and Dara as well. I'll turn this over to Dara for any final comments.
Yeah, we're out of time, so I'll keep it brief. Thanks so much, Jim, and I would just like to echo your sentiments of gratitude for all the presenters. Thank you so much for the time that you put into pulling these slides together and for the presentations. It's just been phenomenal. So thank you for that. And Jim, I don't think you mentioned about August, have you?
No, that's next up.
Oh, okay. Well, then I'll turn it back over to you.
Sounds great. Yeah, we will not have an August webinar. We start back up in September, on September 15th, the same day of the month and the same time. And our next up, everyone will be participating in sharing for 1 or 2 minutes one best practice from the grant. And then following that up will be our last webinar in October that will have us sharing one best practice for sustainment after the grant. So you can look forward to having some template slides sent to you about 2 weeks prior to the webinar. So in the 1st of September, around there, you'll see some the template slides come in. So thanks, everyone, for participating today, and have a great day, everyone. Bye-bye.
Everyone, bye-bye.